Hello, everyone. My name is Bill Carroll. I'm the president of the World Federation of Neurology. It's my very great pleasure to welcome you to this closing webinar for the 2020 World Brain Day. This year's World Brain Day campaign focused on Parkinson's disease. It's fitting then that this final webinar is being held in conjunction with the International Parkinson and Movement Disorders Society Virtual Congress. Next slide, thanks. This is the 7th year the World Federation of Neurology has held this event. As with previous years, the World Federation of Neurology has partnered with the appropriate specific organisation from the Global Neurology Alliance. We're both proud and honoured to have the International Parkinson and Movement Disorders Society join us, especially its president, Claudia Garcia, and others. World Brain Day continues to evolve from a single day on July 22nd, the anniversary of the foundation of the World Federation of Neurology, to extend from July 22nd for 2 to 3 months, which allows more flexibility, more exposure, and more reach. The reach for each World Brain Day has risen rapidly thanks to our media partners, Yakety Yak. Last year's World Brain Day campaign featured migraine, which was partnered with the International Headache Society and reached a total audience of more than 50 million people. This same webinar attracted 2,000 registrants, and this year the 2020 figures have been replicated. I should also mention that World Brain Day is now recognised by the World Health Organization and is listed as one of their named days. Next slide. Parkinson's disease is one of the neurological non-communicable disorders. With stroke, headache, and dementia and others, neurological non-communicable disorders represents the leading cause of disability and the second leading cause of mortality, according to the Global Burden of Diseases study. You can see Parkinson's disease is down the bottom of this slide, but the important thing here is that it, like stroke and dementia, occurs later in life. Next slide, thanks. This next slide shows the most recent global neurological disorders study illustrating the prevalence of Parkinson's disease to have risen from 2.6 million in 1990 to more than 7 million in 2016. More importantly, in regard to the overall burden of disease, especially with the COVID-19 pandemic where health resources are stretched, the prevalence of neurological non-communicable disorders, including Parkinson's disease, is set to rise dramatically in the coming years. On the right-hand side of this slide, you can see that there is some association between increasing industrialization and wealth, as shown by the gross domestic product per capita increasing along with Parkinson's prevalence. Next slide. Today we have a series of 5 experts from around the world, each addressing a topic crucially related to Parkinson's disease. Before we hear from them, there is no better way to set the scene for this important webinar than to listen to a person with Parkinson's disease. Today we have the opportunity to hear the story from one such person who is also a physician and a colleague of mine. Before we do, I wish everyone an informative and helpful webinar. I especially thank those attending today, and I'll now hand over to Professor Tissa Wijeratne, our moderator. Thank you.
Thank you, Bill. We would listen to our colleague, Professor David Blacker's video first, and then I'll introduce the next speaker.
Hello, my name's David Blacker. I'm a neurologist in Perth, Western Australia. For more than 20 years, I've done mainly hospital-based practice, with my subspecialty being stroke. I'm also a clinical professor at the University of Western Australia and the medical director of the Perrin Institute for Neurological and Translational Science, which is one of Australia's most exciting and innovative new neuroscience I've been asked to say a few words about the upcoming World Brain Day with its focus on Parkinson's disease.
I've been asked to say a few words about the upcoming World Brain Day with its focus on Parkinson's disease.
But because I'm a part
Not because of any of the positions that I hold or the work that I do.
I've had it for quite some years now, and it initially began with an exercise-induced dystonia which affected my right foot. With the course of time, I developed more of the classical symptoms of bradykinesia, tremor, and difficulty writing. And just getting around and moving at work and filling in forms and paperwork became increasingly difficult several years ago. So whilst I knew it was there, it took me a little while to get the diagnosis confirmed independently by one of my colleagues. And about 18 months ago, I disclosed the diagnosis to my friends and colleagues. And that was quite an experience. But I'm glad I'm through that phase and into the next phase where I can start looking forward. Thankfully, I've had an excellent response to L-DOPA. But what and I'm sure many patients seek, is true disease modification and hopefully something to help with the non-motor symptoms. I'd really like to be able to smell properly again. I'd really like to have an uninterrupted, good, solid night's sleep every now and then. I sincerely hope that the emphasis of Parkinson's disease as the topic of World Brain Day later this month will help to stimulate ongoing research into treatments and more effective therapies for Parkinson's disease. I'm a firm believer that exercise, good solid physical exercise, and lots of it, is an important core component of any Parkinson's treatment program. I think a healthy dose of probably non-specific aerobic exercise is important, but just as important, I think, is very targeted, focused, movement-based exercises that concentrate on balance, strength, and stability. I myself have been walking briskly for maybe 15 to 20 kilometres per week. I do 1 to 2 sessions of yoga per week, always including a long session of deep stretching. I play golf once or twice a week. But what I'm really excited about is non-contact boxing. This has been popularised mainly in North America, and there are many Parkinson's patients who are having a lot of fun doing it. But there's not a lot of good quality evidence about the correct dose, the optimal timing, and what to do at various different stages of PD. I'm in the privileged position of actually being able to answer some of those questions, and I'm in the process of developing a non-contact boxing program for Parkinson's patients. I've had the privilege of working with a former national boxing champion who's now a boxing trainer with more than 30 years of experience, in combination with a neurophysiotherapist, an exercise physiologist, and my movement disorder colleagues at the Perrin Institute. And I've been a guinea pig for this program, which we hope will start later this year. After only 4 or 5 months of very good training, I'm already feeling stronger. I think my balance is better and my endurance is better. So I remain optimistic about my own personal health, and I actually remain convinced that with very good, targeted, careful exercise, that we may have already a tool that helps to slow the progress of the disease. I therefore offer that encouragement to other people with Parkinson's disease, and I encourage you to be optimistic, to be healthy, to live your lives to the fullest extent that you possibly can. I also challenge my neurological and movement disorder colleagues to make the most of World Brain Day and to continue the search for better and longer lasting treatments for this condition. Thank you.
Thank you very much, David, for that inspiring speech. It is fitting with such a wonderful record-breaking movement disorders virtual congress, which is spreading appropriate new knowledge all over the world, to start this closing webinar. with a patient with enormous amount of positive thinking, as our agenda for this year World Brain Day is ending Parkinson's disease. Next slide, please. It is also fitting to remember that Movement Disorder Society was actually born in 1980s. I was in my secondary school at that time. At that time, we had less than 1 million Parkinson's disease patients in the world. While almost close to 20,000 of you all are watching exceptionally high quality presentations at this Movement Disorders Congress in 2020, we now have over 7 million people suffering from Parkinson's disease all over the world. In other words, when Movement Disorder Society grown over last 3-4 decades, Parkinson's disease almost quadrupled. I can't think of any other disorder affecting mankind that has grown at such an alarming rate. Obviously, the current COVID-19 pandemic is hitting us from all fronts. I'm talking to you from Melbourne, very early hours of the morning. In fact, this is curfew time for us, which is quite historic. Melbournians didn't enjoy curfew for the last 100 years. And also, when you look at COVID-19 pandemic, it is certainly affecting Parkinson's disease patients to access to care. I can't see my patients physically easily due to restrictions and other issues. My Parkinson's patients with high-end therapies, infusional therapies, they can't get the access to care as they used to be. And the early reports from colleagues also reminding us that perhaps patients with Parkinson's disease could potentially get impacted negatively. It is early days. There are different sides to the story, but it is still a fitting and timely reminder how very important for us to get behind this impressive and ambitious World Brain Day campaign and promote brain health worldwide and working together to end Parkinson's disease. Obviously, I don't want to retire from neurology seeing that the Parkinson's disease continue to double and triple and quadruple for the next 20-30 years. I'm inviting you all to join us. Join World Federation Neurology and International Parkinson's and Movement Disorders Society ambitious campaign of ending Parkinson's disease through a number of ways, as you can see from my colleagues over the next 30 to 40 minutes. It is also worthwhile remembering that the brain disorders are the leading cause of disability, as Bill very correctly pointed out early on during this the webinar of our couple of months long World Brain Day campaign. It is the growing fast, but if we work hard, we can end this the enormous amount of growth looking at preventative aspect and promoting research and education and other activities, as you could hear from my colleagues soon. Next slide, please. It is my enormous pleasure, firstly, to warmly congratulate Professor Claudia Garcia for historic, game-changing, most successful Movement Disorders Congress virtual. You have basically allowed education to go across the world liberally and freely all over the world. Thank you and congratulations. And she will be talking to us at this webinar next. Claudia, over to you.
Yes, I'm really happy that people all over the world really accept and obviously enjoy our Congress. We are now more over than 18,000 participants. And I can just mention, as I'm the professor of neurology at the University Medical Center in Göttingen and head of the Paracelsus Elena Hospital in Kassel, and as the current president of the International Parkinson and Movement Disorder Society, we really all welcome you also for this event. As you have already heard, Parkinson's disease continues to increase globally, and the older the people get, the more likely it is that they develop Parkinson's disease. The next slide, please. In the group of those aged 50 or younger, there is 1 in 100,000 people with Parkinson's disease. In the group over 60, there is 1 in 100, and finally in the group over 75, it is already 1 in 50 people. And these rising numbers globally depend on the increase on the elderly population worldwide, but also on the longer duration of the disease with better treatments and on environmental factors. Not only the numbers of Parkinson's disease have increased, also the burden of the disease, which means the amounts of years living with disability, they have doubled for Parkinson's disease during the last generation. Next slide, please. These disabilities are caused by the various symptoms of PD, which affect the whole body like a systemic disease. The key features of Parkinson's disease are the impaired motor skills, which include the slowing of movements, the bradykinesia, mostly starting in one hand or one leg, or just people getting much slower at any daily activity or at walking. The typical tremor of Parkinson's disease, the shaking, is a tremor at rest, which occurs at times of relaxation, at watching TV, or just sitting. Any tremor will worsen with getting more excited. The postural imbalance complicates the picture, mostly after some years, and may lead to falls. In addition to the impaired movements, there are many different non-motor symptoms in PD, which are early signs of the disease observed years before diagnosis. A typical sleep disorder with lots of activities during the state of dreaming, loud noises, even violations of patients or bed partners can occur. And this is called REM sleep behavior disorder, a specific early sign of Parkinson's disease. Early features can also be an impaired sense of smell, as we just heard in the patient's video, a dysregulation of the blood pressure while standing, so-called orthostatic hypotension. And even psychiatric symptoms can accompany early disease, but may also be present anytime during the disease. These various combination of symptoms over time characterize the individual picture of the disease, which should be diagnosed as early as possible for proper treatment. Thank you.
Thank you very much, Claudia, for that presentation. We talked about how common this disorder is, and thank for reminded you how disabling this disorder is, being a cause affecting almost human life. Our next speaker is Professor Wolfgang Grisol, the Secretary General of World Federation of Neurology. He is very well known for his work on advocacy, and I strongly recommend his book on advocacy to be a useful handbook for you when you join us to this ambitious campaign of ending Parkinson's disease. Professor Grisol will talk about advocacy in general. Professor Grisol, thank you for joining us today.
Thank you, Tisa, and thank you to all of you. And we are excited about the World Brain Day, which has been a success so far, and we've been excited on the participation of so many people. Could I have the slide, please? Advocacy literally means to speak for someone. You take the word for someone who is in need to be helped or who is in need of something. And it's usually considered to be an altruistic move. And therefore, advocacy is within the scope of medical doctors implicitly and also within healthcare professionals. Advocacy should help our patients to gain access to quality care and also receive life-changing treatments or even essential medications, which are unavailable in many parts of the world. This is one of the tasks of the World Federation of Neurology, to be able to get the needs and also to avoid all inequities worldwide, which is one of our main goals. Now, advocacy can be done by everyone. Everyone can be an advocate, and every one of us may need to be advocated for. I always imagined it at 3 levels. The micro level, which is an individual, it may be someone who needs your advocacy. And what we have learned from patients is very often patients are excellent self-advocates. And sometimes with this advocacy spirit, they break the rules and they make us aware that things have to be changed. There's also a meso level. That means that advocacy may be needed in an institution, in a town, in a smaller environment, let's say to implement a new therapy, to implement a new drug, to implement a new treatment. And this is one of the concerns of the World Federation, and is also why we're here now, it can be done on the global level, which we call macro advocacy. And this day of World Brain Day is a good example of macro advocacy. So in summary, we advocates need and aim to reduce the barriers to care and also enable research. And I'm sure that advocacy is needed at all stages of the disease. Thank you very much.
Thank you, Professor Griswold. For viewers who are attending this historic MDS virtual congress, if you want to advocate, and I invite you to advocate, of course, make sure that you visit both our websites, download the toolkit, keep advocating on our ambitious agenda, ending Parkinson's disease. That is advocacy. Our next speaker is Professor Victor Fung. Victor is an esteemed movement disorders neurologist from Australia. Victor will talk about recent advances in Parkinson's disease, hopefully continue pushing further hope of ending Parkinson's disease campaign. Victor, over to you.
Thank you very much, Titha, and hello to everyone. It's a pleasure to be here. I'm representing the Movement Disorder Society. I'm currently the co-chair of the Publications and Oversight Communications Oversight Committee, but have played a number of roles as well elsewhere in the society. So I'd like to talk to you today about research into therapy for Parkinson's disease. It's been 50 years since the importance of dopamine deficiency in Parkinson's disease was recognized. The long-term effectiveness and safety of levodopa as the cornerstone of treatment for Parkinson's disease has been clearly established. Many additional oral medications have been discovered to assist in stabilizing the way dopamine replacement therapy is delivered to the brain. And when oral therapy is no longer sufficiently effective, major advances in device-assisted methods of delivering dopamine replacement to the brain or functional neurosurgery can help patients regain control of their disease and life. It's also been shown that not treating Parkinson's disease leads to a progressive deterioration in function and reduced quality of life, as does inadequate explanation of Parkinson's disease to patients at the time of diagnosis. Therefore, before talking about recent advances, it's vital that clinicians and people with Parkinson's disease understand the diagnosis and best utilize the highly effective treatments that already exist. And clinicians and governments also need to consider how to ensure that proven oral and device-assisted therapies are available to people of all countries and socioeconomic status around the world. In the last 20 years, we've come to understand the importance of non-motor symptoms in Parkinson's disease. Mood and cognitive disturbance, gut and autonomic symptoms such as constipation, drooling, dizziness, sleep disturbance, fatigue, lack of drive. These play a major role in affecting the quality of life of people with Parkinson's disease and their carers. Yet still, these non-motor symptoms remain relatively underappreciated and undertreated by clinicians. There's a relative lack of research into effective treatment of non-motor compared to research into motor symptoms, for which there are already many highly effective treatments. Therefore, it's vital that new discoveries and knowledge already gained are better integrated into treatment and research. Most of the long-term problems of disease progression in Parkinson's disease relate to non-dopamine related and more widespread brain dysfunction. A much greater emphasis on addressing these issues is urgently needed. There is clearly hope on the horizon. Approaches to treatment which can potentially impact upon whole brain dysfunction, such as clearing alpha-synuclein or manipulating the gut microbiome, are examples of research already underway, and some promising results of such studies are being presented for the first time at this Congress. Effective disease modification in Parkinson's disease will only be successful if a whole brain approach is taken and if we take it together. Thank you.
Thank you very much, Victor, summarizing recent advances and hope for the future. Our next speaker is Professor Susan Fox, the chair-elect Pan-American Section Movement Disorder Society. Without awareness and education, it is difficult for us to run an ambitious agenda of ending Parkinson's disease and truly end disability and lack of research in Parkinson's disease. So Susan will talk about awareness and education. Over to you, Professor Susan Fox. Thank you for joining us today.
Thank you, Tissa. My name's Susan Fox. I'm a professor of neurology at the University of Toronto. I'm a movement disorder neurologist, and I've also served the MDS in many capacities, and I'm delighted to be here on behalf of the MDS. And I really want to thank the World Federation of Neurology for highlighting Parkinson's on this World Brain Day. So I'm going to talk about a very important topic, which is awareness and education. And we'd like to work together to diagnose earlier, treat more effectively, and improve the lives of both those living with Parkinson's disease and their caregivers. Parkinson's disease is a journey. It begins with a diagnosis, and it continues for the lifetime of a person with Parkinson's and their family, surrounding communities, and their healthcare professionals. There are many challenges and obstacles that each person will encounter that are unique to that person with Parkinson's disease. We're now increasingly recognizing the uniqueness of Parkinson's in individuals. One person with Parkinson's is not the same as another. And we know that the age, the gender, the genetics can all influence the way a person responds to medication or has symptoms with their Parkinson's. And this is leading us down the route of individualized medicine and precision medicine for everybody with Parkinson's disease. To help everyone with Parkinson's, we want to increase awareness. This awareness needs to be global, across the world, within every continent and country. And today's World Brain Day is just one large global effort that's going to bring, we hope, more awareness to the disease and the millions that are affected by it. And then thirdly, and most importantly, education is critical for people with Parkinson's and their caregivers to help them take this journey, to understand the treatment and the management of this condition. But education also needs to extend to governments, to healthcare policymakers, to the general public, to support every person directly or indirectly affected by Parkinson's disease. Thank you.
Thank you, Susan, for that great talk. Remember to visit various MDS sites to continue to educate so that you can translate them back to high quality patient care when you head back to your clinic. It is my pleasure to invite our final speaker for the day before we open this up for question and answers. 2020 World Brain Day campaign had been a roller coaster ride. Despite all beliefs, we have run an ambitious agenda and reached out to so many of you worldwide. It is fitting for me to invite our president, Professor William Carroll, World Federation Neurology, to give us some concluding remarks, looking back over the last couple of months and looking forward for the future at the same time. Bill, thank you so much.
Thank you, Tissa, and to our audience. I'd like to say that the World Federation of Neurology is extremely grateful to have had the opportunity to collaborate with the International Parkinson's Disease and Movement Disorder Society on this initiative, and to have its experts share their knowledge with all of us. As Tissa intimated, this was not the product of a small group of zealots. This was the product of a large group of people who worked tirelessly in a team to get this organized. And I'd like to thank all of those who helped prepare this 2020 World Brain Day and to ensure its success. I'm going to mention a few things in a minute, but I also want to emphasize a point which Tissa Wijeratne made, in that we need to raise the importance of brain health generally. Parkinson's disease is one of the more urgent of those, but brain health is so important to everyone's livelihood and to their quality of life. With regard to Parkinson's disease, apart from the insights that we've heard from our speakers, the important message for us, I believe, is to continue to advocate for increased awareness of Parkinson's disease, increased access to better care, and greater research efforts. I would urge you all of those who are attending to continue to talk to the media, to talk to your colleagues, your patients and Parkinson's disease groups, and even to members of your governments. Parkinson's disease needs ongoing improvements in education, research, and care. Together we can do it. I urge you to work with us and with yourselves to help defeat Parkinson's disease and to promote brain health globally. Thank you.
Thank you very much, Professor Carroll. Thank you very much for all our panelists and our media partner, Yakiti Yak, Ashley, Morgan, and rest of the others. Thank you for our head office in London, and thank you for MD's head office staff also. Now I will open this session up for questions. We do have the first question coming from Daniela, Ebro, Brazil. Daniela is asking, what advantages physical exercises can bring for people who suffer of Parkinson's disease? Perhaps I would pass this question to Victor, and then I might come back to Claudia to add further things.
Sure, thank you, Tissa. Thanks, Tissa, and thanks for your question, Daniela. Exercise in Parkinson's disease can take various forms, and there's been many different avenues of research looking at different types of exercise, be it aerobic exercise or resistance exercise, strength training, balance training. In general, there have been positive results for almost all forms of therapy that have been explored in terms of quality, not just physical fitness, but in terms of quality of life. Some forms of exercise in some groups have shown an improvement in walking and balance and reduction in falls risk. But I think the most exciting thing about exercise that is beginning to be discovered is that the potential for exercise to perhaps modify the course of Parkinson's disease. So great interest now in whether exercise might reduce the progression of Parkinson's disease, Several studies have now shown that high intensity exercise can actually improve motor function independently of medications in a sustained manner. And so, I think the way that most movement disorder specialists are now thinking, and hopefully this will filter to neurologists more generally, is exercise should be part of on the prescription, you know, the first time we meet someone with Parkinson's disease, not just medications, but a prescription for how much exercise they should be doing, what sort of exercise, and the type of exercise might actually vary during the course of someone's illness with their Parkinson's disease as well. So Claudia, I don't know whether you have any further comments or additional comments.
No, I think you beautifully responded to that. I may only add that just recently, one of the 2 papers of the year in the Movement Disorder Journal showed that exercise in Parkinson could even improve sleep, not only subjectively, but even objectively with measuring polysomnography, which is really rare for Parkinson's disease sleep. And we already heard from our patient that he would like to have an uninterrupted good sleep in the future. So I think doing exercise may help to this. And this is an amazing finding that many of the also non-motor findings may improve by exercise.
It is somewhat fitting to remember the father of neurorehabilitation, who is actually a German neurologist. As I heard, if I remember correctly, there was this cerebellar disorder patient who came to his clinic, and he was doing the finger nose test, and he asked from the physician, "Doctor, did I pass the test or fail the test?" He responded saying that you failed the test after thinking twice or thrice. A couple of months later, this particular patient came back to this German neurologist back again and asked him to redo the test, and he passed the test at that time. I read somewhere that that was the beginning of exercise therapy in medical disorders in general and neurology in particular. Question for you, Claudia. There are the thoughts about impact of dancing in Parkinson's disease. Can you elaborate on that? What additional benefits that a Parkinson's disease patient can get by participating in dancing activities? What is the evidence base for dancing as a form of physical therapy in Parkinson's disease? You could possibly add yoga and stretching, as our patient David Becker mentioned on this video. Can you comment on that?
Yeah, there are some studies out on this, on dancing in Parkinson's disease, and there's even one study about tango dancing, and this is even published in the New England Journal some years ago, and they compared it to other physical exercise, and what finally came out that dancing is a good method to improve the fitness, but it's not superior to any other exercise. But the major difference was the dancing was much more fun for the participants and the patients compared to aerobic and other exercise. So you may think about this in patients who like dancing. You can advise them to do dancing, but this needs then the same time frame, several hours a week, and several times, and an intensive training. That's the only way really to get some improvement in Parkinson's disease, not just once a week and mild training. And similar things apply to other physical activities. It depends usually on the frequency and on the intensity.
Bill, do you want to pass the next question?
I have a question here about stress. Is that the one?
Yes.
Yes. So we have a question here. It doesn't say who it's from, but the question is, can daily stress worsen Parkinson's disease symptoms? So perhaps, Victor, this might fall to you.
Mm-hmm. So I'd be interested if Claudia knows of any specific studies. I'm actually not aware of any really good studies that have addressed this question with, to give sort of good evidence. So I might give you my thoughts and then hand over to Claudia just in case she knows of some studies that I don't know about. So I think of stress as immediate stress and chronic stress. And so immediate stress is when you're being chased by a lion, and or in the case of someone with Parkinson's disease, it could be a situation where they're forced to try to get money out of a wallet and it's difficult because they've got a tremor. And so under those circumstances, it's very common for people to develop an immediate increase in their tremor or increased difficulty doing something. People can also switch off. People who have significant fluctuations in their motor function can switch dramatically off in response to stress. And presumably there must be something working at a synaptic level that we don't fully understand in terms of dopamine levels as well. Less commonly sort of commented upon is chronic stress. And where I think about this, although I don't really understand too much about it, I'm sure all of us have looked after people with Parkinson's disease who, upon retiring, feel that their Parkinson's symptoms improve quite significantly, and so that there's been something going on at a low-level stress level that has affected their illness in ways that perhaps neither we as their clinicians or they themselves have realized. So I think sort of Claudia or Bill or Wolfgang, for that matter, what are your thoughts?
Claudia.
I can only agree with Victor. I just may add that there were some animal studies in rats with chronic stress, and there is an entire, I would say, research on stress in neurodegeneration and for animal studies, and they showed some enhancement of the disease and also progression with more chronic stress. But I don't know any real good study in Parkinson patients, as chronic stress is also quite difficult to measure over time then, and would agree that the acute stress level often brings out a worsening of symptoms, especially with tremor. That's very obvious, the increase of tremor in stress situations, but also of achinesias. And we know this also from other diseases. If there's some infection comes up, or then the Parkinson's disease really worsens. For chronic stress in PD, I would be just cautious to say that this is significantly influenced.
Wolfgang, would you like to add?
Yes, I think the two things that come to my mind. One is that sometimes there are examples that acute stress, I think you mentioned the crocodile or the lion, kind of breaks the hypokinesia, which is an interesting effect. And for the chronic effect, I think it's very important that, of course, multitasking is necessary to, the multitasking goes back in disease, and probably chronic stress takes some of the mechanisms to cope with impaired multitasking, would be one of my theories. And maybe that's one of the possibilities for the chronic stress.
Thanks, Wolfgang. I think as clinicians, we've all seen patients with a variety of neurodegenerative conditions worsen when they're struggling to maintain their employment or their family with the underlying illness, and that results in what we call chronic stress, poor sleep, poor exercise pattern. All of those things then feed in, including hypertension related to stress, feed into worsening brain function. It's not necessarily irreversible to begin with, but it doesn't do any good in the long term. So I think we're waiting for the studies to prove this, but the evidence that clinicians see is that it is not good for brain function.
For the audience, please feel free to text your questions on the chat line. This is your opportunity to ask any questions from any one of us. The discussion is going pretty well. I agree with all the comments so far. I think the sympathetic nervous system and parasympathetic nervous system imbalance and maladjustment cannot be a good thing. It has been corrected. So we are waiting for the studies. So whatever that you can do to manage stress as positively as possible and as best as possible, and only do a good thing rather than bad. So for the audience, please feel free to throw your questions at us. You can type your message on your right-hand side, and they will come to us, and then we will direct them to the appropriate speaker.
You have a question there, Tissa, if you want to do that.
Yeah, let me see.
The diabetes as a risk factor.
Is there any risk factor for developing Parkinson's disease if they have diabetes? Victor, you
maybe
want to
start question. There was just yesterday a very recent session on environmental factors and Parkinson's disease, and Connie Maris from Canada nicely pointed out the really increased numbers of Parkinson's disease in diabetes. And so patients who have a diabetes and then develop Parkinson's disease, they seem to develop also a more severe form of PD, maybe also with a faster progression of the disease, both on motor and non-motor symptoms. And I think this is an observation that we also make in our hospital very often. We have diabetic Parkinson patients who are severely ill. So I think one should really take care about Parkinson patients with diabetes, and this may be related to the chronic inflammation, also to the inflammatory process that's underlying both diabetes, and maybe influence also via the alpha-synuclein, the Parkinson's disease. And there was then the question, can we improve those patients when we improve diabetes? And this is still an open question. We do not have interventional trials to answer that, but it may be an option that we have to control the diabetic condition better in these patients. I don't know if you want to add something about this, Victor.
No, not really. Only that there are trials of GLP-1 inhibitors and diabetic drugs, as many of us are aware, you know, that are ongoing. The theoretical reason is slightly different, but that's it's a question of whether the actual sort of these are not in patients with diabetes, but in patients treated with diabetic drugs. So so there's an interesting potential relationship there too.
Victor, this question also reminds me the MDS video challenge. I think you and Maria nailed one of the cases came from India. It's not Parkinson's disease. How persistent recurrent severe hypoglycemia can present as coliform dystonic movement disorder, paroxysmal. And I use this opportunity to encourage our audience, medical in particular, to make sure that they visit video challenges. Clinicians are beautifully dissecting how the clinical reasoning help you to come to the appropriate diagnosis.
That's true.
Any other questions?
Yes, we do have one here that's for Victor. Tissa, if you mind, from Henning in Germany. Victor, this question asks, what are the most cutting-edge treatment approaches for stopping or slowing, that is, disease-modifying treatments for progression?
Mm-hmm. So I hinted at this a little bit with my talk. So the results are or the studies are still very early, but one of the things that has hindered our ability to really address Parkinson's disease is that Parkinson's disease is not just a multi-system brain disease, but it's actually a multi-system body disease, with the peripheral aspects of the peripheral nervous system being affected, not just the central nervous system. And so a lot of the excitement maybe 20 to 30 years ago was looking at transplantation into the basal ganglia, a very specific part of the brain to restore dopamine function in that part of the brain. But those approaches never really addressed the issue of what to do with the disease elsewhere that's going on in the brain. So now people are looking at, as the discovery back in '97 that mutations in alpha-synuclein, the first discovery of a genetic, monogenic form of Parkinson's disease, led to the understanding that alpha-synuclein is intimately involved in the pathogenesis of Parkinson's disease. And so now people are looking at various ways of manipulating alpha-synuclein levels. So with one of the studies in humans being presented at this Congress in late-breaking abstracts looks at immunizing people with Parkinson's disease against alpha-synuclein. Other forms of treatment that are being trialed involve infusing antibodies towards alpha-synuclein in the hope that those antibodies might penetrate the central nervous system and mop up sort of excess alpha-synuclein. So that's one approach that is very exciting. However, we don't know which direction. These are very much experimental studies, and whether they ultimately end up turning the Titanic in the right direction or the wrong direction is still anyone's guess. But these studies need to be done to find out. And then there's a lot of interest, not just in Parkinson's disease, but in various illnesses about the role of the gut microbiome and microbiota, and whether ultimately manipulating the microbiota, which is clearly abnormal in people with Parkinson's disease, might somehow make the conditions that are leading to Parkinson's disease more favorable, in terms of for making the disease less severe. So I think, to me, they're two of the most exciting sort of approaches. And again, sort of, Claudia, I don't know what your thoughts are about sort of other approaches that are being trialed.
No, I think you addressed this as the main approach are the alpha-synuclein antibody studies currently, and there are several ones ongoing, but there are also some studies using small molecules, and they may just start maybe the end of the year, and others on a drug that's nilotinib. I think that's also just came out, but couldn't show any lowering and improving of progression or no symptomatic treatment as well. So I think there is, especially on the immunological side and also on the alpha-synuclein side, a variety of new approaches. And I think we may have in the next 2 or 3 years more results on these ongoing clinical trials.
I think Claudia touched on one of the very important the theme, inflammation. One of the silver lining of COVID-19 pandemic is we all had a crash course on how critically important inflammation is for the brain, and the bioenergetic failure at cellular level, mitochondrial contributions, and so on and so forth. With such a massive crowd attending MDS virtual congress, all these things would set us in the right direction to answer these 2 holy grail questions: detect Parkinson's disease early, prevent Parkinson's disease when possible, and then find the disease modifying therapy on all the armamentarium that Victor and Claudia both mentioned so far. As all good things come to an end, we are now coming closer to the closure of this ambitious and very successful World Brain Day campaign 2020. thanks to everyone, and my sincere gratitude to all the attendees today, the Movement Disorder Society, World Federation Neurology, and all our other partners, partner societies worldwide of both organizations, American Academy of Neurology, European Academy of Neurology, all patient organizations. My sincere apologies if I missed any of the names. You all have supported us to get here, and you all will support us to continue to advocate for Parkinson's disease and beyond that, the brain health, as Professor Carol mentioned. Although the webinar, the conclusion webinar ended here, the promoting Parkinson's disease education and advocacy should not stop here. Let this be the beginning of a new journey. Let us turn the best advocates out of us during these most adversarial times. Human beings are very able to adapt. If you look at past pandemic, our past colleagues have always come up and delivered really good goods to the humanity. And I doubt we would do anything different to that. Despite the hardships that we have, despite I'm talking to you from a city which is in curfew, in complete lockdown, and looks like until about mid-November. But despite that, I'm bringing positive hope with the help of all our colleagues worldwide that together we can promote best brain health worldwide. Together, we can end Parkinson's disease-related disability, lack of research, and find the most burning question that you have been throwing at us. Again, my sincere gratitude to all of you who attended today, and make sure that you visit our virtual booth, make sure that you use fabulous, fantastic opportunity that MDS has provided to you, 100% free to learn and then take that back to your patients who are the most important, the people of our existence on this planet. Thank you very much, everyone, and have a great day.
Thank you, Tissa.
Thank you.
Thank you, Tissa.